background of our trial is actually if we could increase the efficacy eventually of pembrolizumab plus chemotherapy in patients with head and neck squamous cell carcinoma with PD-L1 less than 1. And mainly this is a phase 1 that tests the toxicity of the association of ICOS-1 antibody plus pembrolizumab and chemotherapy with platinum, either cisplatin or carboplatin, plus 5-fluorouracil. However, we also present another cohort of this multi-cohort phase 1 clinical trial with pembrolizumab alone plus chemotherapy. Actually, with basically instead of the 4-drug regimen, so the 3-drug regimen, so the ICOS plus the cisplatin or carboplatin plus 5-FU. So this is part of a larger phase 1 trial. It's called INDUCE-1, and in the other results of the association of ICOS-1 antibody and pembrolizumab alone have already been presented earlier at other meetings and showed actually to be manageable without significant increased toxicity. So in our 2 cohorts of patients, we actually found that for both cohorts, for the ICOS alone plus chemotherapy or the ICOS plus pembrolizumab plus chemotherapy, the toxicity is manageable with main side effects, which are the same of pembrolizumab immunotherapy plus chemotherapy. And so we found that in particular with the association of, so when we use cisplatin, of course, we have more cytopenia, in particular neutropenia and neuropathy. When we use carboplatin, actually, the cytopenias are less. We also present in our abstract 2 significant responses of 2 patients. One was treated with cisplatin, 5-FU, ICOS, and pembrolizumab. The other one was treated with carboplatin plus 5-FU and ICOS and pembrolizumab. Both had significant responses, almost complete responses, and that lasted at least 6 months. So, so we basically concluded that the addition of ICOS-1 antibody plus the pembrolizumab plus chemotherapy is feasible without increased significant toxicity. And we are already planning to move it forward into a phase 2/3 randomized trial in the first-line metastatic head and neck squamous cell carcinoma, which will be called INDUCE-4, and will start accruing by the end of 2020.